Picture this chilling reality for a moment. You're sitting at your kitchen table, enjoying a quiet morning. Maybe you're scrolling through the news. Maybe you're stirring your coffee. Maybe you're simply letting the sunlight warm your face. Everything feels normal, predictable, safe. And then, in less than a second, something shifts. Your fingers fumble. Your grip slips off the cup. Your tongue feels strangely thick, as if it doesn't quite fit in your mouth. Maybe the room tilts, or your vision blurs, or your words tumble out in a way that doesn't sound like your voice at all. These moments aren't loud. They aren't dramatic. Strokes rarely announce themselves with screaming pain or grand theatrical collapses. Instead, they whisper quietly, suddenly, terrifyingly, and millions of people mistake those whispers for exhaustion, low blood sugar, or just one of those days. But a stroke doesn't wait for you to make sense of it. Inside your brain, cells are suffocating. They are running out of oxygen. Every minute that passes, every tiny, ordinary minute, millions of those cells die, and the abilities they control begin to fade with them. Speech, balance, memory, movement, clarity. This is why doctors say, time is brain. Not as a slogan, but as a fact. But here's what most people never hear. Even before the ambulance arrives, even before a doctor sees you, you have a short window of power, a small, critical slice of time where your actions can protect your brain, keep you safe, and help professionals save your life faster. Before we talk about those actions, we must talk about something even more important, recognizing the moment a stroke begins. A stroke doesn't always look like the dramatic scenes in movies. Sometimes it begins quietly. Maybe the world tilts for a moment. Maybe you try to smile and the left side of your mouth refuses to cooperate. Maybe your arm feels heavy and unresponsive, as if it suddenly belongs to someone else. Sometimes the warning is as subtle as dropping your fork, saying the wrong word, or feeling like your body is slightly off in a way you can't explain. Some people describe it as a plug being pulled inside their head. Others say it feels like their brain suddenly misfired. Others simply feel a wave of confusion, as if they're aware of what's happening but unable to react the way they normally would. You don't need every symptom. You don't need dramatic collapse. Even one sudden change in your face, arm, speech, balance, or vision is enough to act. And if you are older, or have high blood pressure, or diabetes, or heart issues, or you've had a mini stroke before, you must treat every sudden neurological shift as serious until proven otherwise. Now we begin the 7 critical actions, not dramatic medical heroics, not treatments, but simple steps that keep you alive and safe until professionals take over. The first thing you must do is sit down immediately. When a stroke begins, your brain loses control over your balance and coordination. Many people stand up in confusion, try to walk to another room, or attempt to splash water on their face, thinking the sensation will pass. This is one of the biggest dangers. A fall during a stroke can cause injuries that complicate your recovery far more than the stroke itself. By sitting down right away, you protect your body from collapsing onto hard floors, sharp edges, or corners that could break bones or cause traumatic head injuries. This isn't weakness or panic. It's strategy. You are securing your physical safety so your brain can fight its internal battle without additional trauma. Once seated, position your body safely. Stroke specialists recommend sitting upright or reclining slightly with support. This helps keep your airway open and prevents complications if you feel nauseous or dizzy. Some people collapse backward or slump forward when symptoms intensify, so propping your body safely ensures your breathing remains steady. Lying flat is not recommended for most people because it can increase pressure in the brain or create problems if you vomit or lose consciousness. A slightly elevated position allows gravity to assist your breathing rather than work against it. And then comes the moment that matters most. You must call emergency services immediately. Not your doctor's office. Not your spouse in the other room. Not a neighbor or a family member. People often delay because they don't want to cause a fuss or they hope the symptoms will fade. But strokes don't fade. They worsen quietly, and every delay takes options away from the doctors who are trying to save you. When paramedics hear the word stroke, they activate a specialized response pathway. They alert the hospital before you even arrive, so the CT scanner is cleared, the neurology team is ready, and life-saving medication is prepared the moment you're brought through the doors. every second matters, and that phone call is your direct line to survival. While waiting for help to arrive, focus on your breathing. A suspected stroke triggers panic, your heart races, your breathing becomes shallow, and your body floods itself with adrenaline. This panic response narrows the blood vessels in your brain, tightening the very pathways you need to keep open. You must consciously shift your body back into a calmer state. Take a steady breath in, hold it for a moment, and release it slowly. Imagine your exhale gently opening the vessels in your brain, keeping blood flowing, keeping oxygen moving, preventing your body from spiraling into further distress. Slow breathing stabilizes your blood pressure, eases your heart's workload, and helps your brain remain as clear as possible during the emergency. Next, you must note the exact time your symptoms began. This detail is one of the most important pieces of information doctors need. Certain life-saving medications, especially clot-busting treatments, can only be given within a very specific window. If you tell doctors you think it started maybe 10 minutes ago, that uncertainty can prevent them from giving you the treatment that could fully restore your speech, your movement, or your independence. Look at your phone, a clock, the oven timer, the TV screen, anything. Say the time out loud. Fix it in your mind. That single detail can change the outcome of your entire recovery. Once your position is stable, your breathing controlled, and the time remembered, stay completely still. When you move, your body demands more oxygen, and during a stroke, oxygen is a resource your brain desperately needs. Avoid walking, pacing, bending, or going to unlock doors. Many stroke patients try to stand up again because they feel embarrassed or want to look okay when help arrives. None of that matters. Your only responsibility is to protect your brain by conserving every bit of energy. If you are alone and absolutely must unlock the door, do it only if you are already very close to it. If not, stay still. Paramedics will find a way in. And finally, avoid eating, drinking, or taking medication. During a stroke, your swallowing reflex may be compromised without you realizing it. Drinking water can cause choking. Taking aspirin may help if your stroke is caused by a clot. But if you are having a bleed, even a tiny one, aspirin can make the situation dramatically worse. It is safer to take nothing until professionals can determine the exact type of stroke you're experiencing. This is the truth many people never hear. The difference between tragedy and survival often happens before the ambulance even arrives. It happens in the kitchen, on the couch, in the bedroom, in the quiet moment when something feels wrong and you have to choose whether to ignore it or act. By recognizing the signs early, by sitting down instead of standing, by positioning yourself safely, by calling for help immediately, by breathing with purpose instead of panicking, by remembering the exact time, and by staying still and avoiding anything that could complicate your condition, you transform yourself from a passive victim into an active participant in your own rescue. You give your brain the best possible chance. You give your doctors the information they need. You give yourself the opportunity not just to survive, but to recover with independence and dignity. Please, don't let this knowledge stop with you. Share it with your spouse, with your siblings, with your neighbors, with anyone you love. Stroke doesn't wait. But knowledge, the right knowledge, can buy precious time. If this video opened your eyes or gave you confidence for the future, consider subscribing to our channel and sharing this message with someone who needs it. Together, we can protect each other. And now, I want to hear from you. Have you ever faced a medical emergency where quick thinking made all the difference? Your story could empower someone else. Stay safe. Stay aware. And remember, your life is worth fighting for.